Morning.
Hey, good
Hi.
morning.
Morning.
So we just had a tour this morning of the Charleston County Detention Facility. As many of you know, we've been reading in the papers about the number of deaths that have transpired here over the last 2 years. A couple things. This is a complicated issue, and many of the patients, a statistically significant portion of the folks who are here at the Charleston County Detention Center have major mental health issues, and this is not a mental health hospital. That's an issue. We have a growing population here in Charleston County. We're one of the fastest growing areas in the country, and understanding the issues that are behind this. And if you look at the last 2 years, the 7 deaths that have happened the last year and a half, 2 years or so, is higher than what it has been historically. Between 2018, 2019, and 2020, there were only 2 deaths at this facility. And so I support the county councils and the detention facilities effort to have a third party take a look at what's happening here and why. I think it's important to have somebody from the outside. We've got SLED. They've also been in contact with the Department of Justice. Councilman Teddy Pryor has written a letter to the DOJ, which I'm supportive of as well. And having someone from the outside take a look at and understand what is going on here. The other thing that I want to commend Herb Sass and the council on are the raises that they voted on and decided at the end of last year to give to the deputies that are here. They were making $36,000 a year, working one of the most difficult facilities in the state, these detention centers, and barely able to make ends meet. And so they were able to give a significant raise to $46,000 a year. They are already hiring over 10 folks since the first of the year, over a dozen or so. And so that's going to be better because they are understaffed here. And there are over 1,000 individuals at this facility, and the county is understaffed. And so getting that pay increase is going to be very important. And I want my message today is with the deputies who are here, the staff who are here, Charleston County Council, the residents, the citizens of Charleston County, is that we're going to work together to figure this thing out and be as helpful as we can. The last message I want to leave today is that we're going to be working with the detention facility to find some grant funding to help and assist with ways that we can make the facility better. Something that I've been working on with a lot of different organizations within the Low Country. And my message to them today is that this is important. It is a priority. We want to make sure that we get all the resources we can. As a state, we only have 300 beds at the Department of Mental Health, yet we have over 5 million people living in the state of South Carolina. And since COVID-19, the mental health issues we're seeing are significantly higher than they ever have been. And this is a huge issue, not just in the Low Country, but across the state and across the nation. And it's something we've got to try to figure out how we can do better and find beds that are available, because this isn't a mental health hospital and it shouldn't be. This should be a place for people who are committing crimes. This isn't a home. This is not a facility or hospital for the homeless either. We've got to figure out how we can address these issues. And the only way that we can do that is if we work together, if we communicate together. And this was a great first step in doing that. We had county council here, we had deputies here, folks from the detention facility, understanding some of the issues that they're facing and how we can work better together to improve the situation. I know that you all are working, also talking about the contract, because it coincides, these deaths started in 2021. They were not previous to that. And so we're looking at all ways in which to make the facility better. And do you want to make a statement? Driver, do you want to make a statement? Or take
Well, I just want to thank Representative Mace for taking the tour along with us. As you know, a week ago, I stated that I was going to contact DOJ, ask them to come in and do a thorough investigation, let us know what is going on. They need to fix it. We're not pointing the fingers at anybody, but in the last 10 years, our last provider, we only had 5 deaths in 10 years. And this when Rajana took over, we've had now 7 deaths in a span of 2 years, maybe 2.5 years. So those are the things you want to look into, because obviously there's a problem. Now, who's to blame? The DOJ will get to that. But I want to thank you again, Representative, for coming down and taking the time out your schedule. We have our chairman there. I thank you for coming along. You came this morning. But this is not scathing on our officers who work here. They do a marvelous job, but they're short-staffed. They're 31% or 39%, I believe it is, down from what they normally should be. So only got 61%, they need another 39. I think those raises will help, and the starting salaries will help. we just want to get to the root of the problem because families want to know answers, and nobody should deserve to die behind the facility when they're here to go to court.
Shoplifting should not be a death sentence. So, Herb, do you want to?
Thank you. I'd like to thank Representative Mace and former Chairman Pryor for being on this tour along with everyone else. I want you to know Charleston County Council realizes this is a serious problem, and we're working hard to work on it with the Sheriff's Office and with Representative Mace's help. We hope we can take care of this. The mental health facilities for the state, only 300 beds. That makes people stay here way too long, and they should not be here for those purposes. So thank you, Representative Mace,
Of course.
for being here. Thank you very much. Thank you all.
Congresswoman, what was your impression of the inside of the facility?
Well, it's a very clean facility. We went through several different wings of the facility, and I will tell you, you can see it's very orderly from that standpoint. But also the issues we heard today was understaffing, and the raises that the starting salary is going to be a great step in the right direction to get there. This is one of the toughest jobs in America right now, and because of the mental health issues we're seeing exponentially increase over the last 2 years since COVID, it's only getting worse. And our deputies, that's not their job. They're not trained for that. And they need extra support from people that have experience in mental health, whether that's counseling or getting more medical staff. Those sorts of things will make a difference. But so too is finding the right location for some of these cases. They shouldn't be in the jail. They should be where they're getting better care for the mental health issues that they're facing. There are some people in this facility that cannot physically take care of themselves. And, so we've got to figure out how do we find those people a home or a location or a hospital or a place where they can get the care that they need so they're not stuck in jail for 100 days or over a year. And it's a major issue. And so we want to make sure that the detention facility and the county are getting the support that they need. And if we can't find the funding locally or at the state level, I'm going to do my part to try to find resources at the federal level that can assist Charleston County. It's a huge need right now.
Who told you about the understaffing issue today? You mentioned that came up.
The staff inside explained it. They're 61% staffed, and we need to make sure we can get them to as close to 100% as possible. They've hired about a dozen folks since the start of the year with the new starting base salary. That's a great step in the right direction, but we've got to address the medical staffing issues that are, as we're finding out, and I believe once some of the FOIA information comes out, some of the documentation, that will show that there is also an issue with medical staffing here at this facility. And so that is also going to need to be addressed. And I know that the Charleston County Council has already started having some of those internal discussions, but I'm a person who wants data and I want information. And so today too, I was able to get from other sources the data that only five individuals have passed away here in the 10 years prior to 2021. And so we've had 7 since January 1, 2021 here. That shows statistically from a data and analytics and research standpoint that we've got an issue here and we need to address it. It was good to talk with the chairman, with Herb, Sass, and Teddy Pryor also to know that they also are aware and they're looking at ways to, 1, get the information, and 2, talk about finding a solution to this problem.
Representative Mace, hi, I'm Emma. I'm with the Post and Courier. Thanks for speaking with us. You mentioned that you support Mr. Pryor's letter asking the Department of Justice to launch a pattern and practice investigation of potential civil rights violations here. Will you be putting your name on that letter? Will you sign an additional letter?
I support his letter. I'm working on my own letter to DOJ. And again, I'm as someone who wants to get information and better understand. I have a better understanding today after having this briefing, after having this tour, of some of the other issues that I was not aware of previous to today, including medical staffing issues. And I know there have been FOIA requests put out about that. That should be coming out once they get that documentation together. That'll be information that all of us, I don't want to jump to conclusions, but I also think it'll be healthy and important to have a third party take a look at what's going on so that we can make sure that they have the resources that they need, that they can make any modifications or changes to process and policies, or even vendors in this case, as I think will likely be the end sum game here, finding different vendors that can address the needs that are inherent here at this facility.
Was Sheriff Graziano on your tour?
She was not.
Okay. Who invited you here today?
Well, yes,
Yeah.
Teddy told me he was going to tour, and I said, well, I've got some time. Can we do it Monday morning before I fly out to DC? I have never toured this facility, and it was a good opportunity for Herb and Teddy and myself to understand, because one, we're going to be helping write grant letters in support of finding resources for this facility here, number one. Number two, I want to know how I can support Charleston County, but also support the staff, the deputies here.
Yes.
They're doing jobs that they were not trained to do because of the huge needs that are here. And I cannot emphasize enough, if you have 40 to 50% of the individuals here have mental health issues, it's a huge problem. And we need people who are trained and have the kind of background, medical background. Our deputies are not trained to be medical caretakers, okay? And we want to make sure that we're fully staffed on the medical side. And if we need more resources and funding and staff on that side, that I'm as supportive as I can be, because it's heartbreaking to hear these stories of individuals who passed away here, whether it's suicide or drug overdoses or other means, other issues. We want to address it. And I want to be sure that Sheriff Graziano, is going to address these issues. Because at the end of the day, the buck stops with her.
Yes.